Public transit isn't just an economic issue for Arizonans, it's also a health issue because, having a great doctor doesn't count if you can't make it to your appointment. We believe that good public transit can make it easier for Arizonans of all ages and from all corners of our state to see a doctor and get access to essential health and wellness services. Healthcare costs are too high for Arizonans, and the shortage of doctors, nurses, and other healthcare professionals throughout our state only makes it worse. So for many, especially seniors, veterans, and those who have chronic health conditions, the healthcare-related transportation costs can be prohibitively expensive. The good news is that programs such as the FTA's Coordinated Access and Mobility Pilot Program and the Enhanced Mobility Formula Grants provide Arizonans a safe and affordable way to get to their doctor. So my two-part question is for the whole panel. How have these programs helped to improve access to care for patients in need? And as Congress considers a surface transit reauthorization, how can we strengthen these programs to ensure that all Americans can access and afford quality health care?
Well, I think it's critical. We see that with our members. We are having very productive conversations with the healthcare industry because we're starting to learn how they measure, and some of those measurements equate to real economic impact. The things that they focus on, reducing no-shows, and the cost of a no-show versus the cost of the trip to make sure that doesn't happen. ER readmits and the penalties that a lot of healthcare facilities face, we can reduce those. Improper use of ambulances when we don't need an ambulance at $500 a trip versus our services that can do that much more inexpensively. And lastly, timely discharge. I think all of those things can really speak to the importance, and it's nice to see that healthcare is looking to us now to provide these services for them.